Okay, this is chapter 30B, and we're talking about causes of cognitive decline. Atrial fibrillation is a big contributor to cognitive decline. A lot of things can make atrial fibrillation worse. I think the baseline mechanism a lot of times is due to cardiac ischemia. So atherosclerosis, limiting the amount of blood supply to the heart, which will disrupt the normal conduction pathways over time. And there's a lot of other things that contribute to that. Remember, atherosclerosis is a blood clot. Okay, high-fat diets increase blood clotting. Sodium increases vasoconstriction. Infections will increase small amounts of clots, including what we call dense matted deposits. And I talked about that in a previous lecture. The whole Douglas-Cal-Etheresia Pretoria stuff and viral infections can increase that as well. Other things that can increase atrial fibrillation. Corticosteroids can increase hypertension, can cause more atrial fibrillation. Being depleted of magnesium. Lots of Americans, it's very common. The majority are low in magnesium because magnesium comes from plant foods. Magnesium is in the center of chlorophyll. So a person who's not eating much plant foods will have a tendency to become depleted of magnesium. Also, if they're stressed out, because then they're going to lose more magnesium in their urine. If they're drinking caffeine, they lose more magnesium in their urine. If they are, because psychological stress, caffeine and sleep deprivation manifests in the body. The hormonal effects are very similar. Basically, think of them as being the same as psychological stress. Okay, with exercise, you lose some magnesium too. So eat your plants and you get more magnesium. Some people will supplement in it, some are deficient in it, and they might benefit from supplementation to catch up. I personally don't supplement it because I eat only plant food, so I get plenty of it. But that's something to be aware of. Americans also are very often deficient in potassium. Again, because potassium primarily comes from plant foods. Eat your plant foods, you get your potassium. Magnesium in particular, it's hard to get reliable lab levels just because it's more of an intracellular ion. Same thing with potassium. Okay, any stimulant will increase your risk of atrial fibrillation. Nicotine will increase your risk of atrial fibrillation. Alcohol is sort of not exactly a stimulant, but alcohol increases your risk of atrial fibrillation. Marijuana increases the risk of atrial fibrillation. Air pollution. Obstructive sleep apnea can cause hypoxia. That'll increase the risk of atrial fibrillation. Excess calcium ingestion can lead to atrial fibrillation. Diabetic neuropathy can contribute to atrial fibrillation. Cardiac ischemia, with all the risk factors of cardiac ischemia, atherosclerosis. We just went through some of those. High-fat diets, excess dietary sodium, eating oils in your food. Okay, oils are not a natural occurring thing. You should never eat oils. Never eat anything with oil in it. I don't like to eat anything with more than one ingredient because the second ingredient, they can add stuff into it that you don't know what it is. And by the way, atherosclerosis is a blood clot. I've talked about that plenty in other lectures. Atrial fib is a progressive disease. The longer a person has it, the harder it's going to be reverse it. They say that atrial fib begets atrial fib. So the longer you have it, the more you have it, the worse it's going to get. The point being is, if you got it, try to fix it as fast as possible. Optimize all your health parameters as fast as you can, and hopefully it'll reverse and it won't come back. Let your cardiologist know, let your doctor know, all that stuff. Okay, then what did I figure out about dementia? Well, I came up with the Peter Rogers, MD theory of neurovascular uncoupling, which is really a big expansion of the calcium hypothesis. There's other doctors and PhD scientists and all these people who've done a lot of research on calcium metabolism, excitotoxins. Russell Blalock wrote a great book about it in 1997, Excitotoxins, The Taste That Kills. But I'm the one who figured out how to connect everything all together with regard to all the diet problems, all the dietary excitotoxins, as well as all the mitochondrial inhibitors, the SERCA inhibitors, and how EMF contributes to it as well. Martin Paul, wrote an excellent book about EMF, and he's given a bunch of great lectures on it, and the guy's brilliant, okay? But as far as I can tell from studying this pretty extensively, I'm the only one who understood all the different fields and put it all together and put it into a logical way that it makes sense. The neurovascular uncoupling theory, NVU, of dementia causation by Peter Rogers, MD. So that was my contribution to understanding dementia and preventing it, because I said in an earlier lecture that Alzheimer's is a joke and it doesn't tell the person what they can do. And there's other people out there recommending ways to minimize risk of dementia, and they sometimes do say a few good things. However, most of the times they end up selling people a whole bunch of supplements and drugs. And what I'm saying is, look at the populations where people age well and just imitate them. They tend to be rural. They tend to not have all these modern drugs and chemicals. We're exposed to a lot of toxic drugs and chemicals. Aluminum in our water, aluminum in our air pollution, all kinds of toxins in our processed foods, all kinds of other toxins in our water and whatnot that are bad for our brains. Okay, and I came up with the idea because I kept looking at all these demented brains and not seeing anything other than a shrunken brain and diffuse atrophy. The most common thing I see on a demented brain is moderate diffuse atrophy, meaning that it's a moderate amount of brain shrinkage without any big strokes, quite often with minimal, if any, perivascular chronic ischemic changes, the so-called silent strokes, association cortex strokes. And I knew it had to be apoptosis, shrinking the brain, and it had, as a manifestation of atrophy. And I think, Delatorre's work is fantastic, and it tells you a lot of stuff. It basically goes through the stuff related to blood pressure, especially, and just pure blood flow from a cardiac point of view. And I also would say that's, to me, kind of thinking like an internal medicine doctor, an internist. To them, the ultimate holy grail of health is good for the heart, and then they just say good for the heart's good for the brain. But the brain's way more complicated than that, and it's well worth your while to learn, to avoid the things that are neurotoxic, avoid stimulants, okay? Avoid things that inhibit mitochondria, because you need lots of energy production to detoxify the inevitable toxins you're exposed to. And you want to avoid circuit inhibitors for the same reason, because you got to be able to get that calcium out of the cytoplasm. Okay, I gave a whole bunch of previous lectures on it, and including chapters for this book, so I won't go into too much more detail about that. Let's see, and we've already talked quite extensively about the effect of high-fat diets and how they make the red blood cells stick together. And any of the bridging molecules will do it. And the bridging molecules include, high-fat diets, increasing LDL cholesterol. It includes uric acid, which can be increased quite a bit from high fructose corn syrup. It includes psychological stress, caffeine, sleep deprivation. To me, those are all like saying kind of the same thing, because they're going to increase your amount of fibrinogen, make your blood stickier. If you have any type of leaky gut, you're going to get more LPS and LTA, the bacterial endotoxins, and they're going to cause even worse form of clotting. We talked about that, the almost prion-like clotting, amyloidogenic clotting. Let's see, diabetics have tons of cognitive impairment. Most diabetics over 60 are quite cognitively slow. It's been interesting. I talked to some doctors who work in better climates. I work in a northern climate, in the Midwest, okay? And it's pretty cold in the winter. And I think it makes the people stupider. Maybe it's because also they have less access to plant foods all year round, whereas the people in warmer climates, they seem less demented, according to my friend's clinical experience. I'll have to look that one up. I haven't looked that one up, but I just talked to some doctors from southern areas, and that's been their experience. They don't have as many cognitively impaired people. They still got lots of them, but not quite as many as they do up north in the cold winters, where people are eating more meat and oils. The other thing, too, is I noticed my diabetic patients, they're kind of bizarre in their behavior, in my experience. They have no interest, most of the ones I talk to, in trying to fix their problem. And I think it's because they're already becoming stupid that they just don't get it. They think, oh, I'm doing okay, I'm taking my pills. And they just take it for granted. They're impotent, they're cognitively slow, they have a blue toe that's going to be amputated, they're in mild kidney failure, getting worse, they're having visual problems. They're kind of like cows standing in the middle of a field during a thunderstorm, oblivious to it all. And like I said, too, I talked to a whole bunch of diabetes experts that train fellows, and all they know is the drugs. They don't know pathophysiology of diabetes. And then mitochondrial dysfunction was the mechanism of inducing insulin resistance due to excessive amounts of saturated fat, and that goes back to all the work of Michael Brownlee, Gerald Shulman, and other diabetes researchers. And so it just makes sense that anything that inhibits mitochondrial function is going to potentially increase your risk of diabetes. So it's well worthwhile to avoid all that stuff. I have a whole lecture on mitochondrial inhibitors and a whole chapter in this book on that. I gave that lecture already. You can look all this stuff up. There's a playlist for everything in this book, all the chapters. I'm on chapter 30 now. There's about 40-something chapters. And like I said, too, you can't learn this stuff in most doctors aren't going to know any of this stuff. It's not in any of the medical school books. It's not in even the biochemistry books, and I own a whole bunch of them. I had to go into the medical literature to find all these mitochondrial inhibitors. And like I said, I found over 50 of them real quick, and many of them are very common, including SSRI, selective serotonin reuptake inhibitors of depression meds. Okay, I talked about Jack Delatorre. I talked about him quite a bit lately. I talked about continuous glucose monitors in diabetics where they check their blood sugar over the night, Q 30 minutes, and they'll see on their printouts they're often much lower than they had expected at night. They're over-treating themselves with medications. Lots of sleep apnea patients, and nowadays they get sleep studies, some of them, and I've seen them, some of them running really low oxygen saturations at night. So they're dropping the O2 sats in the 80s for a prolonged amount of times. I've seen them dropping their O2 sats into the 60s. They'll say in some of the books that it's because obstructive sleep apnea because of excessive fat in the nasopharynx and oropharynx. But you know what? I look at neck CTs, cervical spine CTs, MRI, soft tissue neck, brains all the time, and I almost never see excessive amount of fat in the nasopharynx and oropharynx. So I don't really think that that's such a significant cause. And I've read some paper about it, and it would make sense to me that they can have a neuropathy contributing to it. You know, a lot of times things are multifactorial. So I think that that's part of it. Okay, let's see. And I was happy when I figured that out. I like it. You know, it makes you happy when you figure something out. And, you know, you want to help people, but most people, the reality is almost no one gets better. Almost all patients just deteriorate. And the reason is almost nobody fixes their diet and avoids toxins. They always go searching around for drugs, and drugs don't really work well. You know, you're not going to cure a dietary disease with a pill. You're going to halt the progression of a dietary disease. Your best chance is to fix the diet and avoid the toxins. Okay, so yeah, like for example, hypertension. You know, Walter Kempner showed way back in the 1940s and 50s. Just put them on a low-fat, low-sodium diet, and almost always the hypertension went away. Let's see. Oh, I just mentioned here too, I do have videos on some other channels. I don't really keep up those other channels as well as I should just because I'm really limited in time. I still work full-time as a clinical doctor, and it's real time-consuming to post these videos. I got more videos on BitChute than anywhere else, but I've also got them on LinkedIn. In the past, I put them on Rumble, but on Rumble, the way it's set up, it's hard to get any views. Let's see. And if anybody ever wants to contact me, they can write a comment here on these videos, or they could send me an email. My email's listed somewhere, like on my cover page or something. Let's see. Oh, yeah, I already talked about this. Obesity, hypertension, and diabetes are so common that, you know, I just expect patients always to have those. Occasionally, I'll get patients that really want to change, and they will, you know, make dramatic improvements. But the vast majority of patients are oblivious, and they just don't get it. They say things like, "Oh, it must be genetic. Everybody in my family has the same disease." It's not genetic. It's because you all eat the same food. So I don't give up on people, but I'm just realistic. You know, if you continue to eat and live in the same way, you're screwed. You know. So that's just how it is. And most people have bad outcomes. That's why whenever somebody says that's normal or nobody does that, go low fat, low sodium, vegan, no oil, I'm like, well, you know, if you want great results, you got to make a great effort. And it's pleasurable because you see yourself getting better, skinnier, more energetic, more clear-minded, looking better. I mean, why wouldn't you want that? And then here, you know, I kind of joke. I have these platonic discussion things, and here's the person asking me, why do you write these books when almost no one reads them? I don't sell that many books. I don't advertise them. I don't have time to pursue this as more than just a hobby. My channel is not monetized. I have no sponsors. The reason I do this stuff is because I know it's true. I want to help people, and I also know there's almost nobody out there doing what I'm doing. The sort of low-fat, low-sodium vegan school doesn't have that many proponents. Okay, some of the most famous ones will be Dr. McDougall, Dr. Esselstyn, you know, Jeff Nelson, Chef AJ, Be Green with Amy. There's a few other ones. Raw Intuition, you know, Matt over there. And there's a few other ones, but there's not that many. Most people are out there, you know, pushing all these good fats and all these supplements and high-fat diets and stuff. Okay, let's see. And lots of great writers never had an audience significantly in their life. It's just a fact. Lots of great books were written in exile. Okay, and I'm a little bit like an exile from conventional medicine. It pisses me off that my brain is not welcome there, you know. When Voltaire wrote English letters, he wrote that from when he was exiled to England. Newton was in exile in 1665 when he did all his great work. Boethius was in exile. Copernicus was in exile. Locke was in exile. Okay, lots of great stuff. Machiavelli was in exile. Cicero was in exile. Thucydides was in exile. Almost tons of great books. They're usually written by amateurs in exiles, the truth. Okay, professionals tend to write for glory, for money, and for just status quo. They don't tend to write out of love for the subject. And they tend to include everything, and they can't criticize anything. They're wimps. Okay, it's good also for a doctor to read in a wide variety of topics. I think it very much enhances my writing and my thinking that I'll read in a wide variety of fields. Most of what people think is science is really just advertising, like all this nonsense about oil. All the big companies, they put tons and tons of money into promoting their products. Okay, and you can't really learn much in schools because they just teach old conventional stuff that supports their field. To me, it's like medicine's trapped in the 1700s. In the 1700s they were obsessed with phlebotomy, which actually does have some medical indications, and now we're just obsessed with pills because they're profitable, and they're good for a few things, like for infections, for Parkinson's disease, for thyroid replacement when appropriate, but they're 1,000 times overused. Okay. Let's see. I talk about the vegan diet. It prevents all the common causes of death. It minimizes the risk. Coronary artery disease, minimizes the risk of cancer, of stroke, of dementia, of kidney failure, of autoimmune disease. And people should be thrilled with that, but the reality is they hate it. Most people hate the vegan diet. I get comments from viewers that their friends and family members scold them thinking it's such a bad idea. And you see all these people on the internet saying things that aren't true. I'm kind of amazed. It makes me sad, but at the same time, it means my channel is useful. You have to realize the system sort of hates the pros. The pros are just considered useless eaters, and it likes to rip them off and take their money. But other than that, it kind of considers them useless eaters who pollute the planet and have no intrinsic value. So that's why don't go looking for the system to care about you, because it doesn't. I can assure you. Okay? It doesn't care about me. And I'm a pretty hardcore scholar for over 30 years, and that means nothing to the conventional medical system. Nothing. Okay? What matters to them is, can you sell a drug? If you can come up with a way to sell a drug, that's about the only thing that is celebrated in conventional medicine. As far as high blood pressure, you're stuck between a rock and a hard place. The pressure's too high, you increase your risk of intracranial bleeds. The pressure's too low, you can have cerebral hypotension causing, like the mouth dilatory brain cells to go into apoptosis. I actually think overtreatment of hypertension is way common, much more common than people realize. I also think that the main thing that happens with high blood pressure, though, isn't that you get intracranial bleeds. They're not that common. The little small microbleeds, CMB, cerebral microbleeds with just a little hemosiderin spots on susceptibility weighted imaging in the brain, the one that's sensitive for picking up those microbleeds, they're much, 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 much more common. They're 1,000 times more common than our big bleeds. But atherosclerosis is super common. I think that's the main thing that happens, is just the hypertension causes atherosclerosis. It's the number one risk for atherosclerosis intracranial is hypertension, and it's the number one risk for those small silent strokes is hypertension. We call them typically periventricular flare hyperintensities because they're high signal on flare sequence in the ventricular regions. And again, I know this chapter is kind of difficult because I'm just sort of rambling on, but it's a way that I was able to include a lot of material. The other chapters, which have all the pictures in it, are, if you haven't seen those chapters first, I'd recommend you watch them because I'll have explained all these things in more detail. I'm just now sort of like putting together some loose ends. So cerebral microbleeds, too, I think that they're more related to hypertension than they are the so-called CAA, cerebral amyloid angiopathy, because I look at all these brain MRIs, and they don't follow the books. The books will say that hypertensive hemorrhages, cerebral microbleeds are central in the basal ganglia region in particular, and that cerebral amyloid angiopathy microbleeds are in the periphery. But guess what? I see them scattered all over the brain quite routinely. And they don't necessarily follow this pattern. I see hypertension patients with them in the periphery. I see old people with them centrally. But the old people might have, obviously, a combination of hypertension and so-called cerebral amyloid angiopathy. And then also the same patients who get hemorrhages in the eye for hypertensive retinopathy get them in the brain. So what I'm also kind of saying is all these diseases kind of flow into each other. And the great thing about that is if you prevent one of them, you got a good chance of preventing the other ones. That maybe they're all kind of the same disease. This stuff all goes together. The high-fat diets not only cause increased diabetes, they also cause increased hypertension. So you avoid that, you decrease your risk of both hypertension and of diabetes and of obesity and of cancer and of dementia. Why wouldn't you want that? Okay, and I looked at all these, diseases causing blindness and, glaucoma, hypertensive retinopathy, diabetic retinopathy, macular degeneration of aging, and they're all related. And cataracts, okay, they all come, from these high-fat diets with dairy and oils and processed food. So you avoid all that stuff, you minimize risk of that. And I can also tell you, almost always, when I look at a demented brain, they've had at least one cataract surgery. The typical patient is diabetic, hypertensive, with poor dentition, and with at least one cataract surgery. That would be like moderate diffuse cerebral atrophy with the findings I just described. That's a typical demented brain that I see on brain MRI. And the horse is out of the barn. By the time you come in with all that stuff, the smart move is start preventing it as soon as you become aware of this. And you can live probably a long time, keep your brain all the way to the end. We talked about excitotoxicity. I gave extensive lectures on that. Iron overload contributes to it all. I gave lectures specifically on that. Oh, here's something kind of funny. I talked to my neurology friends. I talk to neurologists all the time. So I asked the first neurologist, what's the most common cause of stroke? Or the number one risk factor for stroke? He says, oh, diabetes. Okay. I ask another neurologist, what's the most common cause of stroke? He says, oh, the number one risk is hypertension. And I ask another neurologist, and these are all like, experienced, knowledgeable, attending physician neurologists. The third one says, well, atrial fibrillation is the number one risk for stroke. So the question is, how could they all be right? Okay, and there's a way to make sense of it. The hypertensives get a lot of lacunar infarcts in the basal ganglia with cerebral microbleeds. Okay, diabetes just sort of get diffuse microvascular disease in the brain and become cognitively impaired. Atrial fibrillation, they're the ones that form the big clot in the heart and then toss it up to the brain as an embolus and have a big stroke. So that'll be a big clot tossed up from the heart to the middle cerebral artery MCA, and having a big convexity infarct, and sometimes the patient will die from that, be hemiplegic, all these big permanent side effects. Let's see. What else causes cognitive decline? Well, we talked about Parkinson's disease will push towards it. Psychiatric medicines are a common cause of cognitive decline. Electroconvulsive therapy, iron overload, they're all major causes. I think if you're interested in trying to find new major mechanisms of disease, you'll find Douglas Kell and Etheresia praetoris fascinating. I think the Douglas Kell 1-hour lecture on YouTube, like a systems approach to the biology of I think iron overload or something like that. It's a great lecture, and he's a very good dramatic speaker. She's really bright, Etheresia praetoris, not quite as dramatic of a speaker, and she does a lot of stuff with the hematology. And I told you about both of them. You want to know about their mechanisms of blood clotting and the dense matted deposits from the amyloidogen clotting. I think that's a major contributor to cardiovascular disease and to dementia that's not widely recognized. And again, the question that really matters is, well, what can you do to avoid it? Well, don't be iron overloaded. Avoid eating iron-enriched food, so to speak, and meat. And you can donate a little blood and exercise more, sweat more, and then you also avoid all the things that cause leaky gut, and you'll minimize all those risks of clotting. So there's some things you can't avoid, but you avoid the things that you can avoid, and you end up better off. Unliganded iron leads to ferrous redox cycling and generation of a lot of free radicals. I got entire separate lectures on that. I got separate lectures on the beta amyloid proteins aggregating because you change their secondary protein structure from alpha helix, like a cylindrical structure, into a beta pleated sheet. How common is it? I don't know yet how common it is, but it's definitely happening, and it's easy to avoid, so why not avoid it? And my impression, and this is after studying for dementia for years and years and pouring through journal article after journal article and book after book and reading all the papers I can get my hands on, looking at all these brain MRIs, many, many thousands of brain MRIs. I think the best way to explain dementia is, like I just told you, the dilatory theory of, the mouse equivalence vascular hypothesis of dementia due to cerebral hypoperfusion, lack of blood supply, and then my theory, which explains, a mismatch between the rate of neuron metabolic rate, energy needs, versus the amount of energy production, which includes diminished by things that impair blood flow, but diminished also by things that impair energy production, which includes vasoconstrictors, and mitochondria inhibitors and SERCA inhibitors. SERCA is sarcoplasm endoplasmic reticulum calcium ATPase, which basically just means the pump to pump calcium out of the cytoplasm and into the endoplasmic reticulum, so you can get down that level. And then when you add in iron, that just causes more oxidative stress. If you add in aluminum, that causes more oxidative stress. In fact, the big famous researcher of aluminum, Christopher Exile, says he thinks the number one way that aluminum contributes to it is by increasing oxidative stress. But they all have a synergistic harmful effect. Like fluoride, it increases the ability of other chemicals to cross the blood-brain barrier, including aluminum. They'll form complexes. So these things are all synergistically working together to make people stupid. And these other toxins too, like I said, there's things like, atrazine, all the mitochondrial inhibitors, the hexane used to process soy. It goes on and on. That mitochondrial inhibitor lecture might be one of your most valuable ones. I sometimes talk to internal medicine doctors, and they'll tell me that they thought of my lectures, what do they say was the most helpful to them? One was, my explanation for what causes diabetes, insulin resistance. Number 2, what causes atherosclerosis. Number 3, all the mitochondrial inhibitors that so commonly are a part of commonly prescribed medications. Okay, and then the lectures on dementia. Those are some of the ones they find most helpful, and the calcium metabolism as it relates to dementia. And almost all of this stuff is avoidable. Okay. I go into another lectures where I explain the whole deal on glucose type 4 transporters. The bottom line is you don't want insulin resistance because it's not just in the periphery, it's also in your brain, and it depletes your neurons of glucose, and then they can't make ATP, and then they can't pump calcium out. So insulin resistance is a big deal. You can't win with high-fat diets. Anybody telling you otherwise is not telling you the truth. And Nathan Pritikin figured that out a long time ago in the 1970s when he reviewed all the literature on dietary fats. Nathan Pritikin basically said the best way to categorize diets is either high-fat or low-fat. In general, those are the two main categories. Okay, and he said fat is bad. All fats were bad. There's none that you wanted, and I've talked about that before, that the only good fat, so to speak, is fiber fat. No matter what you eat from any regularly chosen diet, you will get enough omega-3s. Okay. This just kind of goes into more detail. If you actually read the book, you'll get more detail about the pathophysiology of dietary fat, how it has such a negative effect on the brain, and how brain cells really can't metabolize it too well. I know there's ketone bodies that can be used in an emergency, but that's not what your brain wants on a routine basis. There's other problems that come from that ketogenic approach. It's not good long term. Hardly anybody can do well with that. Long term, there's all kinds of problems with. There's some special circumstances. We talked about the insulin degrading enzyme has more affinity, more desire to bind with insulin than with beta amyloid, and how when insulin levels are high, it gets used up because the amount we can make is limited, such that you're then less able to remove the beta amyloid. Okay, I know this chapter is kind of dry, so I'm not going into every detail of it. This book was mostly to provide illustrations so people would have all the pictures. You can also, when you watch one of my videos, just click on the print screen button and print an image, and then save it in your own folder, like make your own PowerPoint talk on whatever given topic. Let's see, this is just showing more of the problems with aluminum. It's associated with hyperphosphorylation of the tau protein intracellular within neurons. It binds to the hyperphosphorylated tau. It causes aggregation of hyperphosphorylated tau, making it insoluble. When a protein is insoluble, it becomes dysfunctional. That means it precipitates out of the aqueous solution, the water-like solution, either extracellular or intracellular. Tau in particular is intracellular. It's associated with microtubules, and so when tau becomes dysfunctional, your microtubules become dysfunctional. They're like railroad tracks for transporting things around inside of cells. And so aluminums will aggregate. The paired helical filaments of tau protein will aggregate in association with aluminum and also with ferric iron and form neurofibrillary tangles. So it's all bad. And aluminum is bad too. You can inhale it through, deodorants. The stupidest thing, spraying a deodorant where you're inhaling that stuff and it goes through your olfactory nerve right up to your brain. All right, I think we'll call it there for this being 30B. I'll do one more session on this chapter, call it 30C. We're almost done with it, and then we'll get into some easier, more interesting stuff pretty soon in this book. Okay, so that's it for now. Hope it was helpful.